In this lecture, we'll revisit the concept of a spinal nerve, and we're going to talk about the nerve plexuses. So as you recall, when we talked about spinal nerves, we talked about them being the functional unit of the spinal cord is reflected in the spinal nerve. And you can see that here. Here's a spinal segment and its spinal nerve. And for the most part, this is the basic plan with overlapping dermatomes and very simple, straightforward pathways for the nerves. What I want to talk about in this lecture is the concept of a plexus or a net. And that's where several of these peripheral nerves are going to come together and they're going to form a big network, and then they're going to split up again as they get closer to their targets. So in the next couple of slides, we're going to talk about the concept of a plexus, and we'll go through some of the specific nerve plexuses that exist in your body. There are 4 plexuses that I want you to know about, or plexuses, it kind of, potato, potato. So anyway, we have a cervical, which is going to be involved in the nerves that are coming from the upper cervical, so C1 through maybe C4. We have a brachial plexus, and that again is going to overlap with the C's and some of the upper T's, i.e. the cervicals and thoracics. We have a lumbar plexus, which is down here, and a sacral plexus. So these different plexes have different targets in the periphery. The cervical plexus is the most cranial or the most superior of the plexes that I want to tell you about. It provides sensory and motor innervation to the head and neck, mostly the neck, and it has an odd kind of a distribution in that, remember when we talked about how you have, here's the spinal cord, how the dorsal roots are sensory, the ventral roots are motor. They come together to form the spinal nerve, which is mixed. The ventral primary rami, when the spinal nerve branches, you have the dorsal primary ramus and the ventral primary ramus. When it comes to the cervical plexus, what's a little odd is that we get a redistribution of fibers, in that these nerves that I'm going to tell you about here are actually sensory nerves for the most part. So let's start at the top and kind of work our way through. We first have the greater auricular nerve, which comes up just in front of your ear. So let's draw in an ear. I'm not a real good drawer, but here's an ear and here's an earring. And then below that is the lesser occipital, and this comes up and innervates the skin behind your ear, kind of over your mastoid process, that big bony process that you can feel here. The transverse cervical goes in front of the neck and comes around and innervates this aspect of your anterior neck. The supraclavicular nerves come out and innervate the skin above your clavicle. Supraclavicular, over the clavicle. So they innervate this region here. The motor aspects of the cervical plexus are important in that the phrenic nerve is what innervates your diaphragm. There's a Feist song that I always sing to my students, so I'll sing it to you, and you can just zip through this really fast if it's too terrible for words. C3, 4, 5 keeps the diaphragm alive, and those are the levels that contribute to the phrenic nerve. Cervical levels 3, 4, and 5. The phrenic nerve innervates your diaphragm. There are some more motor branches that also innervate the infrahyoid muscles. And those are the muscles that are they're in the anterior aspect of your neck or your throat, and they are right under the thyroid cartilage. You can feel your thyroid cartilage here. It's in males, it's an Adam's apple. And the infrahyoid muscles, the hyoid bone, oh, you don't want to palpate that. It hurts, but it's right up, way up in here. It's not comfortable. But there's a whole bunch of muscles that attach your hyoid bone to your thyroid cartilage and to your sternum that help with swallowing and moving the pharynx and larynx around. So those muscles are also going to be innervated by the cervical plexus. And I believe I have some pictures of that in the next slide. Yes. So here, I can't show you all the nerves, But I can show you the supraclaviculars, which are headed out here to where the clavicle is. This is a reflected sternocleidomastoid muscle, so it's not innervated by the cervical plexus. But here are your supraclaviculars, and here are those motor branches that are coming down to those infrahyoid muscles. So you can see some of these. It's hard to see them all in any one dissection, but you can see some of these. And in the next slide, I'm going to show you the phrenic nerve. And here's our phrenic nerve. And it's coming down out of the cervical plexus, down through the thorax. It goes just lateral to the heart, and it heads straight for your diaphragm. In the next segment, we're going to talk about the brachial plexus, which innervates your upper extremity.